You're tuning in to Living Well with LaShanna. Hey, this podcast brings a fresh perspective on wellness, womanhood, and wisdom. And whether I'm steering this ship solo or I have a co host with me, we're going to help you remove complexities that surround holistic living so you can embrace joy and have a life that you can live well. It's time to live, age, and be well and whole. So tune in and enjoy. Join it. Are you ready for this episode? I know that you are. I've been talking to you all about it. Hello, hello. It is your well woman. It's LaShanna Moore. And you are actually signing into what? The Living Well with LaShanna podcast. We have hosted on LaShanna Moore TV by way of YouTube. Thank you, YouTube, for being our platform. And you all have been such great support. I get your feedback. I see your comments. I receive your emails. And so thank you so much for being a part of this community. Now, as promised, I have an exciting episode for you. I have an exciting guest. I have been wanting to connect with this woman for a very long time and to get her on the screen with me so that you all can experience her effervescence, her beauty, her knowledge. She's very knowledgeable, so you're in for a treat. You also know at the time of this podcast, if you're catching us in real time, or even if you're watching by replay, that we're preparing for World Menopause Day. Now, based on how menopause has been treating you, you probably may not even care. However, we're utilizing the holiday to dig deeper in ways that we can take better care of ourselves and enhance our life, and not just the to-do list, but also our joy. We know that our wellness is connected. Let me reverse that. Every other area of our life is connected to the state of our wellness. And so we can only have joy in as much as we are feeling good from the inside out. So we dedicate this podcast episode to World Menopause Day and to your health and well-being. I'm going to allow me to read her just a brief introduction about her, and then I'm going to bring her on for you all to see. So her name is Joanne Mitchell-McLaren. She's a born-again believer whose life and work are rooted in faith, service, and compassion, with more than 40 years in nursing, including 30 years as a nurse practitioner. She has been honored to serve patients across every stage of life, from newborns to elderly. So, beyond her professional journey, her greatest blessings are personal, being a devoted wife to her husband, Mark, for 33 years. That is something for us to applaud. She's also a proud mother to two incredible young adults, and for her, the highest calling is to serve. With that conviction, it has guided her path as a healthcare leader, a patient advocate, and health ministry leader. Over the past 4 decades, she's led a health and wellness ministry and championed patient rights and worked across healthcare systems, the pharmaceutical industry, and underserved communities, educating individuals about their conditions and empowering them to lead healthier, more informed lives. Lastly, but not least, she is the founder and the CEO of Patient Advocate for Transparency in Health LLC, an organization born out of her unwavering commitment to ensure every patient is heard and equipped to make empowered decisions about their care. So, after hearing that, you know that this is an episode where you're going to be seen, heard, and provided for. I'd like to welcome to the screen Miss Joanne Mitchell-McLaren. Everyone, there she is, the founder of Path Health. Miss Joanne, thank you so much for joining me.
Absolutely. And good day to the audience. And what a blessing it is to sit on this platform today. I have eagerly awaited for this opportunity to work with such an organization. And LaShayna, we met a few years ago,
Yeah.
and it has just been a blessing. And I look forward to meeting
Yes.
many of you who continue to follow
Right.
her to improve your life as we move forward. So today we're going to jump right in. We're going to be talking a little bit about diabetes and the peri and postmenopausal things that unfortunately sometimes come up, which puts us at a greater risk for things. So the introduction, she did such a fabulous job. The only other thing I would add is I am a proud listee in the Marquise Who's Who in America publication
All right.
24-25. And that was such an honor for me to get a call to say, we've heard so much about you and are you interested? So I'm thankful today, and we're going to jump right into the next slide. So today what we're going to do is we're going to talk about diabetes and uncovered, like what are the dangers, the diagnosis, and even some of the advances in treatment. Our next slide. So what is diabetes? Now understand that today I can't give you everything on diabetes, but I'm going to give you a high level overview of the things that will cause you to pause, to think, and give you questions that you want to move forward with your own provider to ask to make sure certain things are being done. So what is diabetes? It's a chronic condition that affects how your body processes glucose, some people say sugar, in the blood. Now, normally, your body produces insulin to help glucose from your blood to move into the cells for energy. And then we're going to look at, there are three main types of diabetes, but we're also going to expound on the peri and postmenopausal that puts us at greater risk in this presentation as well. Next slide. So what is the difference? Well, there are genetic factors, and then there are environmental factors that are linked to diabetes. Let's start off with type 1. Type 1 diabetes, it is indeed an autoimmune condition. The immune system attacks the insulin-producing cells in the pancreas. Now, the exact cause is not fully understood, but scientists have known that there are some genetic factors. And when we think about type 1 diabetes and we look at the age across the lifespan, about 15 to 20% will be children, and the other 85% are adults. Now, let's move over to the type 2. Type 2 is caused by insulin resistance. And what that means is the cells do not respond properly to the insulin. And over time, what happens is the pancreas can't produce enough insulin, resulting in high blood glucose levels. Then the third type is gestational diabetes. This happens when women are pregnant. So hormones during pregnancy make the cells more resistant to insulin. But the minute a woman delivers, generally the gestational diabetes resolves after delivery within a day or two. Next slide. So what are the diagnostic tests? Now, this, of course, if you're going in, this is really specifically for type 2 diabetes. And if you're an adult and you're over the age of 45, or you're between that 40 and 45, these are the things, when you go in, every physician, every nurse practitioner, PA who you're seeing, if you're going in for a complete physical, a fasting sugar and a hemoglobin A1C should be done at least once yearly, unless you're at higher risk. So hemoglobin A1C, if those markers are greater than 6.5%, they're looking at you are steering at diabetes. Fasting blood sugar or plasma glucose, if it's greater than 126. Now, this means you're getting up, you're going in to your physical, and you're fasting. That means you haven't eaten, you haven't had coffee. This is a marker. If it's greater than 126, that's an issue. The other test is a 2-hour plasma glucose, right? Greater than 200 milligrams per deciliter during what we call an OGTT. That's an oral glucose tolerance test. Fourth, a patient with symptoms of hyperglycemia or who has a hyperglycemic crisis meaning they're not feeling well. They show up to the hospital, or they're going to their doctor's office, and they do a fasting, they do a glucose, period. It's just a stick. And they say, oh my goodness, your reading is greater than 200. And I've known many patients who unfortunately ended up with levels at 500 because they didn't know what was going on, and that's dangerous. Our next slide. So what are the risk factors for diabetes? There are a number of risk factors, and you'll see some of them have overlapping properties as we go through this. Number one, obesity. Excess body fat increases the body's resistance to insulin. Then there's physical inactivity, right? So a lack of exercise leads to weight gain and insulin resistance. Again, overlapping. So you have obesity, and then if we don't have any kind of physical activity, of course, again, we have excess fat. Family history. So having a parent or a sibling with type 2 diabetes increases your risk by 2. Now, it may even be a maternal grandparent that has diabetes. The risk is still relevant and there. Your age. Risk increases with age, especially after the age of 45. And then, of course, we have to look at unhealthy diets. So increase intake of processed foods. Let's think of all the fast food chains that are out there that people run to. Sugary treats, while we all like them every now and then, in moderation, they're okay. But if you're having ice cream and cake every night and candy, not good for you. And unhealthy fats can contribute to obesity. So when you think about unhealthy fats, I always think about folks that like to fry. Everything they consume is fried, and it's fried in the wrong oils. It's just not good for us. Next slide, please. And we're going to continue talking about these risk factors. So you have abnormal cholesterol levels. Now, you hear about your HDL, which is your good cholesterol, and high levels, though, of LDL. Just think of L. If you can't remember, like, which is bad, L is for lethal. And if you think of lethal, that's the one you don't want elevated. That's your bad cholesterol. Or if you have high triglycerides, right? The other risk factor is for women, we call it PCOS. It's polycystic ovary syndrome. Women with PCOS are likely to develop insulin resistance. And then, of course, gestational diabetes, which we spoke of earlier for women as one of the types, when women who had diabetes or gestational diabetes during pregnancy, their risk of developing type 2 in the future is increased. And then ethnicity. Sadly, African Americans are at the top of the pyramid. We followed by Hispanics, Latin Americans, Native Americans, and some Asian populations. Now, that doesn't mean that Caucasians don't have diabetes. They do. But unfortunately, African Americans and these other races or ethnicities are at a higher level. And then pre-diabetes. So having higher than normal levels of sugar, but you're not officially diagnosed with type 2. If you go to your physician's office and they say, well, you know what, your levels are sitting right at the border, you need to do something about that. Take a listen. Don't just ignore it and say, I don't need to make any changes, because you have the power within you to do so. Next slide, please. Now, complications. High blood sugars, known as hyperglycemia, if not properly managed over time, can affect different organs and systems in the body. So we're going to review this because, unfortunately, diabetes is not just a blood sugar thing. There are so many comorbidities and organs in the body that would be affected. And I say that it destroys many organs. So we're going to go to the next slide and talk about those things. So let's start with cardiovascular. Our heart is the most important organ, I mean, without it functioning properly, we have all kinds of issues. So narrowing of blood vessels, decreasing blood flow increases your risk of heart disease, stroke, and hypertension or high blood pressure. Now, then there's nerve damage known as neuropathy, which is pain, tingling, numbness, and weakness. And you'll hear many patients who have diabetes, and especially if they're not well controlled, say, you know what, I've got this tingling, numbness in my feet and in my hands. I don't understand what's going on. Foot and healing complications. Here, diabetics reduce, when you have diabetes, it will reduce the body's ability to actually fight infections, right? So you get poor circulation, you have nerve damage, and these can lead to foot ulcers and infections and even amputation. So I'm sure maybe you all know someone perhaps that has diabetes for a number of years, and perhaps they don't see, the right physicians during their course of diabetes. If you have diabetes, it's important every year to at least go to a podiatrist and have your feet checked, making sure you dry your feet appropriately and examine your feet, daily, at least weekly, to look for any signs of infection. And if there's something there, to get it taken care of. Because when amputation starts, generally it will start with a toe and then several toes. And then, we have a foot, and then your, below the knee amputation. It's just not a good thing. Kidney damage, which we call diabetic neuropathy. This is damage to the kidney's filtering system, and it can cause kidney disease or even kidney failure. And I don't need to tell you, if you need a kidney, that is a difficult thing. There's not an abundance of kidneys just lying around. So it's best that we maintain our diabetes and keep these levels in check. And then I think of the mental health aspects, right? Just having diabetes, knowing that you have to do your sugars and so forth, and you have to stay on top of things, eat well. It can be depressing, and it can cause anxiety in patients. Next slide, please. And further, we have eye complications, damage to the blood vessels in the retina, called diabetic retinopathy, which can cause blindness and increased risk for cataracts and glaucoma. Then there's skin conditions, skin more prone to bacterial or fungal infections, right? We call that diabetic dermopathy. And if you're an African American or darker descent, you may see light brown spots. If you're a Caucasian, you may see red spots. Or if you're more of a lighter skin African American, you can see red spots. Hearing impairment. Diabetes can cause the risk of hearing loss. And then, of course, there's cognitive issues. Over time, the risk of cognitive decline and dementia and possibility of Alzheimer's increases with the disease. Next slide, please. Now, of course, we have peri and postmenopausal challenges. Now, first, I just want to give you a brief definition of what peri and postmenopause are. So postmenopausal, that means 12 consecutive months without any menstrual cycle, no spotting, no nothing. Perimenopausal means you're still having a menstrual cycle. They may be infrequent, but they're not completely gone. Now, during this period of time for women, increased risk for diabetes occurs because early menopause, that means before 45 years old, increases your risk. And then, of course, hormonal changes. So we have decreased estrogen in our bodies when we get into these phases, which leads to adipose fat tissue and that develops around the waist. And for those of us who were so proud of our waist back in the days, oh boy, you wonder, where's all this coming from? It is a estrogen issue, which causes greater adipose tissue around there. And then because we have increased adipose tissue, it increases our risk of diabetes through insulin resistance. And unfavorable lifestyle factors contribute even to greater risk of developing diabetes. So the older we are, we can't just pull back and say, no more exercise. No, we need to be more astute in what we're doing, getting physical exercise and maintaining our bodies so that we help our bodies to fight against diabetes. Next slide, please. So management, the first order of business in managing blood sugar levels is diet, exercise, and then medication. And regular checkups can help reduce the risk of complications. So we're going to explore some diabetic management. And unless your levels are so skewed to the right and elevated, every good provider should offer diet and exercise first. And I want to put a plug in lest I forget. Please, if you have diabetes, if you've been diagnosed, ask for a referral to a registered dietitian, not a nutritionist, but a registered dietitian, because they have some medical knowledge as well. And these people can really carve out exactly a diet for you that is most beneficial in helping you to maintain your sugar levels without these fluctuations, or you trying to do this on your own. Next slide. So diabetic treatment, we're going to talk about from the traditional to the cutting edge to the costly. All right, so here we see several things in this picture. You see sneakers, a jump rope, some weights, you see fruits, and I mean, this is ideal, like for maintaining all these components here. So with your lifestyle changes, most providers will recommend a Mediterranean diet. What is that? Well, you got legumes, it's more plant-based, you got fruits, you got vegetable, and very lean cuts of meat. And then of course, exercise, right? Increase your aerobic exercise. Some may say, I don't exercise. I can't do the difficult thing. Understand, walking is aerobic exercise. No matter what age you are, we can all walk. And it helps best in its early stages too, like that pre-diabetic phase. Next slide. So diabetic treatments. Of course, first-line medication in type 2 diabetes. If you were to ask 100 providers, they're going to say metformin, because it helps the body better utilize insulin, therefore by lowering blood glucose levels. And then on the newer side, we have these SGL2s, the semaglutide products. Now they're expensive, but you have Jardiance and Farxiga. How do they work? They decrease glucose reabsorption at the kidneys, which helps to eliminate glucose through the urine. They're great for heart and kidney function, and you'll have a modest weight loss. Next slide. Diabetic treatments continuing. Insulin. Now, insulin is a life-saving treatment for type 1 diabetes. However, it's not first line for type 2. Insulin-dependent type 2 diabetes can be considered severe. So over-reliance on insulin injections without addressing lifestyle factors, right, such as diet and exercise, can lead to poor long-term blood sugar control. Next slide. Now there's the GLPs. Now we're getting to the cutting edge and the costly. These medicines, right, they mimic a hormone called GLP, which are normal functions in the body, right? It increases insulin production in response to meals, but it also slows gastric emptying and reduces your appetite. Thus, some of the most common ones used today, Ozempic and Wegovy, those drugs have caused people to transform. Like if you've seen somebody pre Ozempic and then you see them a year later, you're like, wow, they look like a completely different person. I don't have anything against these drugs, but if you stop them, well, a whole lot of things revert back. So I think healthy lifestyle and changing some things is the best way. And both have been shown to have significant results in weight reduction. However, keep in mind there are side effects to these drugs. So you want to know some of them are mild while some of them are severe. Next slide. So here are some of the common complications and adverse events from GLPs. One of the most common is nausea, vomiting, diarrhea, constipation, and some abdominal discomfort. But these are transient. So over time, your body becomes adjusted to this and you end up doing well. And some of those things subside. But for some people, they don't. On the other side, it can affect, you can also have headaches and dizziness and fatigue. So if you're having dizziness and fatigue, but you still have a job, that might not work out for you. Serious but rare side effects have been noted in some of the studies: pancreatitis, kidney issues, and gallbladder, meaning gallstones. So keep it in mind if you're anxious to run to your provider and say, hey, I want to get on Ozempic, I want to get on Wegovy, think about the side effects. Next slide, please. So I hope today that you feel a little more empowered and informed and confident in managing your diabetes and really understanding your options and feeling more at ease with the condition, and advocate for yourself and your loved ones and the people in your community. I think that, overall, it is so imperative that we advocate for ourselves. So I work as a patient advocate. My organization is Patient Advocate for Transparency and Health. If you'd like to reach out and contact me in the future, you can do so by calling 903-919-0673 or reach out to pathhealthadvocate@gmail.com. It has been such a pleasure. I can't tell you how thankful I am for this platform today and the work that is being done by Lashana and her team. They are changing lives. And my desire every day is to change one patient's life at a time. And I've been able to do that, but only because I follow the Lord Jesus Christ. And, he empowers me. So even before I have spoken a word about anything and people begin evaluating, they see my heart. And that's how I will continue to do what I do for the Lord and to continue to collaborate with organizations like Lashana Moore. And it has been a blessing to be with you all today. And I look forward to seeing you all in the very near future. God bless you.
Yes, let me unmute myself. Thank you so much. Sisters, let's do our pause, our Selah moment, just to take in everything that has been shared. Diabetic health, diabetic awareness, wellness is a huge part of our culture. Women of color, namely Black women, African American women, this is a huge part of our lives. It is either affecting us, a loved
Yes.
one, a friend, someone in our community, somebody that we know has been impacted. So I want us to take our moment to take a deep breath in, inhale through your nose, and then exhale through your mouth. Such impactful information, practical information, medical information, and lifestyle information that Ms. McLaren has given us today, that we can glean, so much that we can glean from. And so the contact information that she has shared will also, you'll also see it down below in the show description. Ms. McLaren, let me ask you, do you prefer Ms. McLaren or Ms. Mitchell-McLaren?
Mrs. McLaren is just fine. Joanne is even great.
Thank you so much. I have 3, maybe 4 questions for you that are very dominant for a lot of followers and women in my audience and in my
Sure.
followership. One of the questions: does insulin resistance affect men the same as it affects women?
Yes, it does. I would love to say that men have less, but the only thing that I would say that really, because remember, men have a change too with their testosterone, right?
True. Yes.
We as women with that estrogen, oh my goodness,
Mhm.
it is not friendly when we get that decline. A whole lot
Yes.
of things begin to happen, but we are equally affected. One of one gender is not more heightened than the next.
Okay.
We all have difficulties, and sadly, we are all affected equally.
Okay. And so, in the mention of metformin, I know that it is usually the primary go to or part of the Q4 that a physician will prescribe for a patient. How do you feel about inositol, Mayo or Cairo D inositol, in its effect for diabetes or its ability to help a person that's dealing with insulin resistance? Do you think that it can be replaced for metformin, worked in conjunction? How do you feel about inositol?
Well, I have to be honest and answer that question with I've never used it or
Okay,
prescribed it for a
okay,
patient. So I
okay,
really can't give a comparative analysis.
okay.
Metformin has been around, let me say, for probably
Long
60
time.
years,
Yeah,
probably before either of us were born, right? And there have been some improvements, but it has gotten a lot of negative press too over the years, right?
right.
But in
Yeah,
spite of the negativities that sometimes are affiliated with metformin, I think the good outweighs the bad
okay.
for metformin. And so I am not familiar, as I said, with the other
Okay.
products. So I don't really want to try to give an analysis or comparison because I'm not sure.
Certainly.
Metformin
Yes.
is something that I'm very familiar with and I've used. Um, and so I think it's an individual thing, but I would definitely recommend if someone is considering, right, one or the other, you know what? Do some research. We
Hmm.
are we are
Hmm.
such a technology driven
Yes.
world. There is so many platforms that we can use to find out what's the latest studies. You know what? Go to your American Diabetic Association.
Yes.
Can I
Association. Yeah.
tell you, they have everything that you will need.
True. And it stays updated.
Correct. So,
Yes.
don't underestimate the power that's in your own hands. And they've got the truth. They've got the latest studies. They're going to be able to
Yes.
say to you,
That's
well,
good.
we know this or that. So definitely I would encourage that. Because it's a platform that's existed for years and they are empowered and with the latest and the greatest information. So do your homework, and I tell everybody that from an advocacy standpoint,
Mhm.
advocacy means we advocate for ourselves, but you
So,
got to be equipped
right.
and get the knowledge right
Yeah,
from a proper resource to know how you should move forward.
absolutely. Thank you so much for that. And then also for addressing PCOS. We have a lot of women in our fellowship in this audience that have been diagnosed. I was diagnosed with PCOS a
Mm,
few years ago, and really had to learn much more about insulin and how my body was struggling with the processing of
mhm.
insulin. And then my sister girl, Peri Menopause, comes, and Peri and Pico just have the party of their lives in this body.
And it's like, wait a minute,
There's
this
a
is not
party. I was like,
acceptable.
wait a minute. Y'all didn't invite me. I'm the carrier. What's going on here? And so it has been a matter of just vigilant maintenance and
Mhm.
constantly checking in and keeping monitoring of my blood sugar and
Yes.
lifestyle. As you shared, I love that you shared practical, traditional, medical, cutting edge information.
Mhm.
All of this, we can find something that we can
Yes.
pick and choose and apply. I
Yes.
love that. It was so holistic. Thank you.
Of
Thank
course.
you so much for that. You all, I want to make sure that you all are staying connected to the work that's being done, lashanamore.com. I try my very best to make sure that updated information is on our site. One of the things I think that has given us longevity with you all, and I appreciate it, is that we are researching, fact checking, making sure that we are aligned with board certified, licensed, board certified practitioners, practitioners like Miss Joanne that we have joining us today, and that you can trust getting information from what we provide. So if you ever need a resource or to check back or to circle back, make sure that you go to lashanamore.com. We're also going to be including this presentation, not the presentation as a whole, but just a recap. It will be in the show notes for you to come back, listen, replay this as often as you need to, and please connect with Miss McLaren. I'm toggling between Miss Joanne, Miss McLaren. I love this lady. I respect you highly,
Thank you.
and everything that you have accomplished in your life that represents medicine, faith, care, and community.
Yes.
I love what you stand for. I do want to thank you all for watching and catching this episode. I do have something new, and as I close out, that that's a part of our contribution for World Menopause Day, and we have started our Dear Posy Body magazine. It will be a digital magazine. It will be rolling out this weekend. If you're catching this in real time, which, as I mentioned, is World Menopause Day, just a contribution for women to have something a resource that you can go to, that is speaking to you, that is helping you, that is helping to enhance and improve your life. And Miss McLaren, we have you in the magazine as well. That was a surprise I was
Oh,
going to share with you.
thank you.
I'll send that to you. But you all, thank you for being a part of this audience, and thank you for watching. And as always, until the next time, live, age, be well and whole. Bye bye.
Bye.